I'm sure I absolutely deserve it. I think your mother does, like you. It had to be first grade with your mother. They wanted me out of it. When you can grab yours, you know, you deserve to go and take care of out.
You were pretty firm there. You were pretty fair about it. It takes a lot of you.
You're the only one, man. I'm sure I didn't feel like I deserved it again.
No, that's right. Your mom probably hasn't did. Well, that was back to days just that's right. Oh, no, that ain't. Yeah. That's right. You were wrong. Good job with the light. That's right. Or basic. Check them out down here. Still got a couple out. Still got a couple out.
Employees. Yeah, I've got one in the hospital and, but no, I've got two in the hospital. Tested positive. I've got two that are waiting.
Hanging over the door.
No, one that's waiting, test results. One that's been sent home because of, their age, their vulnerable, and one got released.
Hello, everybody.
Hey, none?
Good. That was an excellent report, Lavona.
You're on the back row.
Thanks to Diane.
Wow, that's awesome.
Thank you. Good report, Diane.
I forwarded it on. It was that good.
Ready? You still feel like you're in a movie?
Do what?
I said, you still feel like you're in a movie?
Yeah, that's it. That's it. It's getting scarier. Yeah.
I have coronavirus, but just in my eye.
Just in your eye.
You're going to be keeping
I had to wake up Mr. Johnson and he had to go to his thing last night at 11:30.
Oh, did he give you a new bottle?
Silent.
Yeah. Did you have the pharmacy, have to go to the pharmacy to get it yet?
No, they have to order it in, so he called me to order it today. He doesn't get it until tomorrow, but he has to call it.
Hang on to those, because that, you may go through that little bottle. See, that's what I do every day.
That silent, that was,
It gets some
Steroid.
good for dry. You probably got.
it's not confusing, it doesn't work.
They really want.
What? Oh, yeah.
They give you some of that seed.
He said keep an eye on it. Yeah, keep an eye on it.
So you give you that calm and fast feeling?
No, this is not.
That's bad.
You guys give me some audio and listen to it.
Testing, testing, 1, 2, 3, testing.
Testing? Testing?
Testing.
TikTok?
Testing.
I don't even know what.
Hello,
TikTok
two.
is.
You want to make a TikTok video out of
No,
it?
I don't want to make a TikTok.
Testing, 1, 2, 3.
You're in. Get Kim to do the sprinkler.
I have no idea what you're talking
You were alive.
about. What's that?
I can't.
Oh,
Way
I
to
know
do
what
it.
that- oh.
Or the lawnmower.
Oh, okay.
You know how to do the lawnmower.
Oh, my. We're about 2 minutes out, Jim.
Ready whenever you are.
With my knee, I can only, my knee's healed up, but I can only do one step, I can't do two.
It was fine without. So the purse?
Do what? Oh, well, the governor wasn't gonna come for any reason. Keep remembering, it's his orders that I did them.
I know, but we can play that. That's right. Yeah, I saw that.
He might have had a better offer if he used the governor's speech. Did you see on Emerald TV the other night, they showed them picking up JGS people in Emerald at one of the pickup deals?
Oh, yeah.
I mean, they're all standing around outside and smoking, sharing food. All this stuff with their masks down. And they had 6 buses for them, so they could social distance. They all loaded up in the first 2, wouldn't get off. And they were taking the 2 truck up, but they've been way behind. Okay. I got close enough. You guys ready? Right? You ready? All right. Call this meeting to order. Attendance roll call.
Livingood. Peterson.
Here.
Swager.
Here.
Alvedras. Egger.
Here.
Hoffman. Here. Mr. Petty.
Here.
Mr. Dunham.
Here.
Agenda item number 3 is discussion and possible action on the opening of businesses according to the State of Oklahoma Open and Recover Safely OURS plan. I'll open that up for any discussion, Mr. Dunham or Mr. Wadley.
I think I'll let Chief Watley give his report first over the state of Texas County and Alva. Guymon.
There we go.
Sorry about
Remember where
that.
your checks are coming from now.
Yeah.
Good evening. I believe, do all of you have a copy of this?
No, I did not make copies for everybody
May
for
have
this.
some.
I didn't think about that. I'm sorry, Chief. Yes, why don't you?
I may have extra ones.
Okay.
Thank you.
Thank you.
I guess I could put my mask on, Mr. Petty.
I'm sorry for the delay on this. I wasn't able to get to Joe Don as quick as I wanted to today. There have been some changes in the late afternoon. In fact, one of the changes I'm getting ready to tell you about isn't even on here, and that's changed within the last 3 hours. In Texas County today, it shows that we are at 236. As of 3 hours ago, that number, I talked to another official, it's actually going to be 239, so add 3. We also had our 3rd death today from a resident here in Texas County. In fact, it's a Guymon resident that passed away in the Woodward Hospital that's been there. So in the last 7 days, or when we last met, the Texas County number was at 85. and Guymon is at 57. Currently, over the last 7 days, Texas County has increased to 154 cases. Guymon itself has increased to 111. In fact, the next day, the last Tuesday after this meeting, the next morning it was up 22 by that time. I have below pretty much the numbers for the cities that you can see also below there. Guymon is 168, Hooker's 45, Tyrone's 9. The unspecified, the reason that is on there, it's a new category, and it is when somebody puts a P.O. box that cannot be tracked down. So it could be somebody in Guymon, could be somebody in Hooker, Tyrone, any of the different towns. It could be somebody there, so we don't have it clear on that. I also wanted to give you an idea of what's going on statewide, especially with the county that's just currently Guymon, or Texas County sits as the 5th populated COVID county in the state. We are just below Washington County. Washington County is over by Tulsa County, just a little bit up to the northeast of Tulsa County. Saturday night, they were at 268. Yesterday, they went up by 5, and today they went up by 3. So in a 2-day period of time, they went up 8 cases. Texas County went up from Saturday 172 to Sunday being 210 to today being 239. We are not anywhere close to a slowdown. We are still going higher. I've been in contact with in the last 48 hours with state resources from the state health department. I don't mean the local health department, but even the state level, and also with people that are on the governor's task force. They are now aware of this. They should have seen it coming, but they didn't, because I think they're all have their eyes on Oklahoma. But as all as you know out here, things don't exactly travel from Oklahoma City out here. It is still the path between Amarillo and Dodge City. That is the majority of the nation's meat that feed people come from the plants along that way. When you have employers that have 3,000 plus employees, you're going to have a higher rate of employees that get this. And it's not what they're doing in the plants, it's what's happening when they leave the plants. Not performing social distancing, not doing the correct things that need to be done, going out in large groups, going to homes, all different things that are happening outside the employer's realm. That's where we're seeing this happening. And the cases that we are seeing right now are cases that occurred that are over a week old. Just a little bit ago, talked to the State Department of Health out of Woodward, and they're roughly at about 80 to 90 pending cases today. So we still have that many more coming in. The corona has already surpassed the flu in deaths across the United States. We are hitting age group of deaths in the 50s or 40s to 60 range in our area. This is devastating. And just as the rest of the state knows, if this would get into a nursing home, other places of business that could possibly pass this on, it is very concerning to us. I also have some new updates on asymptomatic patients. They are very concerned about asymptomatic patients, and these are people who don't show any signs and symptoms but are positive. And it could be one of those situations where an asymptomatic person could be next to you and nothing happens. You don't get it. Or if you do get it, you may become asymptomatic yourself. And the only reason that we would know that at a later date and time is if you do the antibody test, which is out there right now. But on the flip side, though, it's not worth taking the chance of somebody being asymptomatic and you or another loved one gets that and have the bad reaction. You don't, nobody individually knows what would happen if you get the COVID. Are you going to be asymptomatic? Are you going to have mild symptoms? Or are you going to have real bad symptoms? That's the big question. Currently, in the last 7 days also, we have transported 13 patients, known COVID patients. I don't have a single staff member that has not been exposed to this. We take all the precautions that we know we can. We are very well prepared with our PPE, and that's what we do all the time. In fact, as we speak at this moment, we're on the road again to Woodward right now with another one tonight. We're averaging almost 2 a day.
Is there guidelines that you do before you take them? I mean, are they really, really sick?
Most of them are.
Okay,
Most of them are.
before you take
Yes,
them to
we do
Woodward?
have guidelines, and I'll kind of put it to you this way. We go above and beyond the guidelines. I would just, we have the protection here. We've had the availability of it, and we're going to take it and do all we can to lessen the chance of our people getting it, at the same time being able to get the sick people to where they need to go.
Is there anything we can do? I had a person call me last week concerned about a party at his neighbor's house that went on through the night, and there was at least 20 to 30 people there. Can we advise them to call the police? Will the police go?
I think the only thing that we can do is just give them information. I don't know if you can break up a party or anything like that. They're doing it on their own. You can't fix people's maybe not real great decisions at times.
For the party disturbing, I mean, that's reason enough for police to go.
Okay.
Break it up, without regard to the virus.
Okay.
When you, Grant, Chief, but all the folks that you transport are under doctor's orders, is that not correct?
Yes.
Okay.
Yes. And this includes the 13 that we have transported and actually made contact with. There's probably going to be a few more. We've made contact with on 911 calls at some residents that were positive. We know they were positive. Discussed their medical situation or injury situation, whatever the case may be, and was determined at that time they did not need to be transported or need further medical care. But it's still a positive to us because we actually made contact with them.
Thank you. Grant, I heard that there's a committee, a COVID committee that I think you're probably on.
Mm-hmm.
Do you guys have a trajectory of where you think we're heading or when we think we'll peak? Or I've heard by somebody, and the reason I asked that, somebody told me they thought by the end of the week we'd probably peak.
Do what now, didn't you?
Somebody thought by the end of the week we might peak. You know.
I'm foreseeing peak probably within, as I said last week, 2 to 3 weeks.
Okay.
And I'm looking more towards the 3 weeks. And that is not because of our local stats. I want you to know that is not because I'm not just looking locally. I am still looking what's going on from Amarillo to Dodge City. And the reason we have to look at that is we have people in Tyrone, Hooker, Guymon, Goodwill, Texoma, and the surrounding areas, including Beaver. People work at National Beef. People work in Dodge City, Garden City. They drive back and forth every day. There are some people multiple people that may live here in Guymon and work at National Beef, and they drive 4 or 5 people. They carpool. Do we know for a fact that they have a mask on? Is that even the right thing to do? Because just because you have a mask on in a car, being so confined, if somebody would be positive or asymptomatic, could they spread something to the interior of the vehicle? And somebody else in the vehicle touching that when they take their mask off, or as they're taking their mask off, putting it on their face? Those are questions that we can talk about all night, but it's happening. Same thing happens with people that are working down in Cactus. As you very well know, our very first death case was an employee of Cactus, from the Cactus plant, but drove back and forth to work on a daily basis.
Do we have enough tests available for people that need to be tested?
We do right now. There's getting ready to be a large supply come in within possibly tomorrow and throughout the week. One thing that we discussed in one of our state meetings today, which the local health department was involved in, they stated they need more tests. I also know that some of the private clinics around here are increasing their amount of tests that they can do included with that. So the rest of the state is kind of idle right now. Oklahoma City, Muskogee, Ardmore, Enid, Delaware County, Tulsa, they're kind of idle right now. They're not having the abundance of calls and COVID-known cases that they were 3-4 weeks ago. We are starting to see it now, and not because of what's downstate, but what's in our area.
Chief, since last meeting, we talked about collaboration in any way with Texas County. Have you seen any changes as far as that goes? Any collaboration going on? Any way that we're working together with the county?
Can you give me an example of what you might be looking at?
As far as possibly helping with the flow of testing, or
Are you talking about the health department or the
Yes.
county? Because they're run a little separate.
health department?
So you understand that in the big scheme of things, since this is a pandemic and the State Department of Health is at their what they call their stage 2, the Oklahoma State Department of Health has actual control of this. They are in command of how to handle this situation. They are from their command post in Oklahoma City and through their different avenues are telling health departments what to do, how to do it, so on and so forth. They don't have to listen to local governments. They don't have to, because in the pandemic, we're at war, basically, is what it is. And they try to set up kind of like a military structure. And you know as well as I do, you don't have to talk to in war-type situations. There are certain people you don't have to talk to. You just carry on and do the job, and that's where they're at.
Thank you.
Now, I would say on this point that today I have had conversations with both Senator Inhofe and Senator Langford's office. They are going to see what they can do to help us. I asked them specifically about the task force that is in Amarillo, or that I read was going to Amarillo. And they were going to be checking into that. They didn't know the specifics of what that task force was supposed to be doing, but they're supposed to be letting me know some more information this week. I've also talked with the regional health department director in Woodward, and she is also looking into how she can help get things sent our way.
Good to go. Thank you.
And just to kind of reiterate what he said, one of the problems that the local health department's having is they have 4 nurses. That's it. That can actually do the calls. In other words, telling patients that they're positive. Follow-ups. So in other words, seeing where they've been, what they've done, who's their family structure, who they've been in contact with, who their employer is. It takes roughly about an hour to do an interview on the phone, and that's common. 4 people, and today we hit 239.
Wow.
And they're open from 8 to 5, probably take off lunch, so 7 hours in a day. We're going up by 20 and 30 per day. There's no way
Can't handle
that
it.
they can do it. So you're going to hear stories, and true or not, don't know, that people, aren't getting called or not being told information. We have a large cultural differences here than compared to the rest of the state. And when they have to call language lines, and there's other hurdles that they have to do. The information is of getting positives and knowing what to do with those people, telling them not to go out and do social visiting, not to go to your next door neighbors or to your family down the streets, because, we say stay in your family. Well, when families are, 20 or more larger and they have, get-togethers of all different cultures and reasons, we will have issues. If one person is positive, then you can almost expect everybody, or at least half, probably going to be positive too within 5 days.
Unfortunately, yeah.
So for a term I've heard, a lot of the cases we're seeing right now could be a result of what you call social circles or social
Yes.
interaction rather than
That's what
job
we believe is
related.
happening. We're also seeing, on a daily basis when they come out, multiple people at residence, so which we expect. If a mother or father have acquired the corona, then you would almost expect the children. But we are not seeing very many people under the age of 19 contracting this. There are some. Can't really say here locally, except the one over in Goodwell. That's been about the only one under 19 that we can safely track.
Grant, will you clear up one more thing that I heard today is that we have, I didn't hear 239, but we have like
236 you'll see, but I'm just saying,
Yeah.
I'm giving you a hot off the press
No.
239.
What I'd heard though was that we had, this is yesterday, that we had like 204 and 64 of them were no longer positive. So the 239 is not active. That's how many we've had in Texas County. That is what the Texas County management, because I argued with them, they said, no, what it says is the total number minus this number is the number of active cases in Texas County.
Well, here's the thing.
So if that's not right,
we
need to get.
we do not know the total number of recovery. Just as I said, those 4 nurses have to follow up to find out recovery.
Oh, geez.
So those same nurses are trying to tell people they're positive and don't have the time or resources to find out who's all
Seems
in
like we need
remission
to,
or in recovery.
they need to set up a call center.
Well, one of the problems is that's on the Texas management. I mean, I think if somebody can look it up, it's on this website that it says that.
Well, I looked on the State of Oklahoma's website, and for Texas County, they have, right before this meeting, they had 74 recovered, and for Guymon, they had 49. That's what was reported
Yeah.
on the Oklahoma State's Department of Health's website.
Okay.
There are plans within the next couple days to, as the health department's going to get further resources, the meetings we had today, it's coming within the next couple days. What it is, I don't know. What it is, I hope
You
I have
don't know
some
in
more
what
nursing
form.
staff. But if things are done by phone, this is my thing. If everything's done by phone, then we physically don't need people out here.
No.
All the health records and stuff that these nurses are looking at are online. They get it on a computer. That can be done from other health departments or other places that are not currently active with corona. That was my observation. Now, the state may have a different plan of how to take care of that.
But there, like you said, there's a chain of command for everything.
Correct.
Okay. Anything
Mr.
else?
Mr. Dunham, are we postponing all board meetings and commissions as far as,
They have been up until now, yes.
okay,
We've postponed everything except city council, authority meetings and such as that.
okay. They are aware, everybody on the boards?
I believe so, yes.
Okay.
Thank you. Thank you,
Thank you.
Grant. Chief,
Thank you,
I
Chief.
should say,
Thanks.
thank you, Chief, excuse me. We appreciate you. Mr. Dunham, you want to add anything?
Well, the only thing that I'd like to add as far as this discussion is concerned is that over the weekend, I was doing some research. I did find a recommended best practices booklet for reopening of COVID. This booklet could be, it could be modified to fit Guymon. This one was specifically for Spearfish, South Dakota. I just provided it to you for your reading pleasure at this point. I'm not sure if we have some of the same capabilities as what South Dakota has. That would be something I would want to discuss with Mr. Petty if the council it sees value in this and would like to move forward with something like this by the next meeting. Then the other thing that I just kind of wanted to bring to your attention is that the swimming pool is slated to open by May 23rd or as soon thereafter as possible. We'll have the contract, I'm planning to have the agreement on the 12th agenda with the YMCA. Most of the Oklahoma State Health Department has released guidelines for swimming pools to reopen. Most of these guidelines are going to be up to the YMCA and their staff to enforce. As far as the getting in the water is concerned, the chlorine kills it, as far as we know. But you'll still have the social distancing and things like that. And what the Oklahoma Health Department is recommending is that the occupancy be reduced by 50%. So if our swimming pool is designed to hold 100 people at any one time, we would only allow 50 in. The way I understand these rules. I know a lot of communities in Oklahoma are not opening their swimming pool this year. But most of the ones that I'm aware of are operated by the city, and it just becomes a logistical nightmare for them to operate that pool under these kind of constraints. I have not had an opportunity since last week to talk to the director at the Y to see if she's still wanting to proceed with this. I assume she is. I'll probably be trying to give her a call in the morning. So just kind of wanted to give you a briefing on that.
So you're going to visit with the YMC what their feelings are, and then we can work on.
Because when last time I had visited with her, we didn't have these reopening guidance from the health department, and I probably need to call her just to touch base with her. She's had a chance to read it.
But I was trying to lead up to that could be an agenda item for next Tuesday. That could be an agenda item for next Tuesday.
Could be.
I think I like that for the simple point, let's see where our cases is going, to Grant's point, too. I mean, I would think that would dictate a lot of it, because we know they're not going to social distance in there, whether there's 50 or 20.
Yeah.
Okay. Anything else, Joe Don?
That's all that I have on this subject.
Can I revert, Grant, can I ask you a question? Did the governor, I think I know the answer, I'm not sure, and of course hindsight's 20/20, but they don't like zone us, like say, okay, they're Guymon areas in the red zone and that means this as a state. They're looking at us as a whole, correct?
That's correct.
That would make good sense.
But I guess to some advantage, the discussions that I've had in the last 2 days is the rest of the state's kind of leveling off.
Yeah.
Not seeing the numbers. So a lot of things that were going on and hyped up and ready to go at other places did not occur. But what they said was going to occur that didn't happen there is happening here. And if you want to say a positive thing is they're able to move resources that are not being utilized anymore or that weren't utilized at all they're gonna start looking at moving some of those resources, and there's all different kinds, from people to equipment to everything, out this way. Now, you did bring up the point about Amarillo. I've been in contact with the feds on that. They are working on what to see exactly what Amarillo was doing. They do have a strike surge team that is there, came in over the weekend. They hit boots on the ground this morning. The federal government has also taken over all of the health department's work areas. They're in the Texas Panhandle, and they're actually doing all that. With that means it's been issued by the governor and Vice President Pence. Governor Stint has been in contact with Governor Pence, or both Governor Abbott and Vice Pence, on the exact same thing. And at some of our meetings today, I also discussed that it would be highly reasonable for the Kansas governor to do the same. So that all three governors are on the page, because it's something that's taken all of the state's resources just in this small area. And we're also looking at just an area of 150 square miles from Guymon is what this is affecting.
Okay, thank you. Anything else? Agenda item number 3. Agenda item number 4 is discussion and possible action to authorize bidding of sanitary sewer infrastructure construction for the Nash Soccer Complex with an anticipated cost of $107,670.
Okay, I'll start off on this item, and I'll let Grant chime in anytime he wants to. But this will be the third time the infrastructure has been bid out for the Nash Soccer Complex. The first time it was bid out, we received one bid that was extremely high. The second time it was bid out, we received no bidders. I had talked with a few of the companies around, asking why they didn't submit a bid. Some of them weren't aware of it. Some of them that I visited with said the job was just really too big for them, and as it was originally drawn up. So what we have done is we've taken out, and we are looking at just sectors. The city of Guymon is going to do the water installation. Because it is over $50,000, we are looking at, after discussions with Mr. Petty and everything, we need to bid this service out. When it is authorized, if it is authorized to bid it out again, I will be sending bids to about 4 or 5 different contractors that I've worked with over the past 3 or 4 years to try to entice them to bid the project for just the sanitary sewer. We've scaled, by doing that, I'm hoping to get it into scaling it down to just the specific service. I'm hoping to be able to bring that job into shape that these guys are willing to bid on it and give us a reasonable bid. The electrical will be the second aspect of it, but the estimates right now for the electrical are that they are not over the anticipated cost of those is only about $35,000. So that should be something we can quote out and find a contractor for. Just as a side note, this isn't going to slow the project down. We issued the notice to proceed to Multicon today with a start date of May 18th and a completed construction by January 1st. In my meeting with Multicon last week, we decided that they could go ahead and start work, get some of their work started without messing with the field most of the field where this is going to be, all this construction is going to be going on. So they've got 2 other fields that they can be working on. They're not going to be tripping over one another. There's a lot of other things that can be done while we are doing the installation of the water, the sewer, and electric. The electric is going to be, everything will be underground. And that's a requirement of one of the grants that we have applied for, is that all the infrastructure has to be underground. And if this is approved tonight, we should be able to have bids out to prospective bidders by Friday of this week. And then we would be looking at opening those bids in about 4 weeks. I think it's actually 22 days. I think it's the exact day, but we usually plan on about 4 weeks from this Friday on this bid. That wouldn't prohibit us from getting finished with the water or the electric, the way it's been presented to me. And I'd be happy to answer anybody's question.
Discussion, questions, motion?
No, I think that's a good route.
I'd make a motion to authorize the bidding of the sanitary sewer infrastructure construction for the Nash Soccer Complex with the anticipated cost of $107,670.
Second.
Have a motion and a second?
Swager,
Aye.
Egger,
Aye.
Alvedras,
Aye.
Peterson.
Aye.
We've got 4 ayes.
You'll stand adjourned. Thanks, everybody, for coming tonight. Be safe.
Be safe.
No, it's discussion. We could have taken action if somebody made a motion to take action. But since